pelvic girdle muscles are going to be the muscles that we see here, sort of coming from the top. I'll talk about those first. So on the dorsal side, on the back side, we have the muscle again that everybody knows. Okay, the gluteus maximus. Okay, this big meaty muscle. Okay, and the dorsal side. Okay, now technically you don't need to take off the gluteus maximus to see the next one, which is the gluteus medius, but I'm going to do it a little bit for clarity. Okay, so this muscle right here, where the fibers are sort of vertical, this is the gluteus medius. Okay, this is the gluteus medius. Now, when I put the gluteus maximus back on, you can still see the gluteus medius. And in fact, this is what you should do. You should look at them both and notice the difference in the fiber direction. Okay, so gluteus medius, gluteus maximus. Gluteus medius, gluteus maximus. Okay, the maximus muscle is going to be a little more at an angle. In the cat muscles, cats, it's going to be oriented a little different, but it will have this sort of same situation. The maximus will be above the medius. But just like we saw with the pectoralis in the cat, the medius is much bigger than the maximus in the cat. Okay, but the maximus will be on top of the medius, just like it is here. Okay. Now, if we rotate forward, we got these two muscles coming off the ilium here. Okay, technically from that anterior superior iliac spine. This one here is a short muscle, long tendon. Or short muscle, long fascia. This is called the tensor fasciolata. Okay, tensor fasciolata. Short muscle, long fascia. Tensor fasciolata. Short muscle, long fascia. Okay, tensor fasciolata, short muscle, long fascia. Okay, you guys may or may not have seen this already in your cats. So these will be sort of so a bunch of you guys, this will be familiar. This next one here is this very thin belt-like one. Okay, this is the human version of the sartorius. If you remember how big the sartorius was in the cat, okay, it's not quite the same, but it does have the same origin and the same insertion. It technically does the same thing in the human as it did in the cat, at least in terms of its direction. Okay, so this is the sartorius. Okay. Now, these three muscles right here, you can see in the front, these are the quadriceps that we were talking about before. Okay, so remember the quadriceps, we have the three vastus muscles on the bottom and then the rectus femoris on top and in the middle. Okay, so vastus lateralis is here. How do I know this is lateral? Pinky side is lateral, big toe side is medial. Vastus lateralis here. Okay, vastus lateralis here. Okay, rectus femoris next. Okay, notice the feather shape, rectus femoris. Rectus femoris. Okay, and then next, vastus medialis, big toe side, vastus medialis. Okay, vastus medialis. Okay, I know the vastus medialis and lateralis, they make that knee bulge. And you see somebody who has big muscles in their thighs here. They have these bulging muscle here and this bulging muscle here. Those are the vastus, the lateralis and the medialis. So then where's the intermedius?
Underneath the rectus femoris.
Underneath the rectus femoris. Now on this one, all you're really going to see is the tendon thing here over the top of it. But vastus intermedius would be underneath here. So on the test, you would see the rectus femoris pulled off, and I would be pointing right here. Okay. Vastus intermedius would be here. Okay. Now, right here, this is sort of the medial side of the leg. Okay, when we looked at the medial side of the leg of the cat, it was sort of oriented upwards like this. So it might look a little different to us here on the human, okay? But this muscle that you see right here over the top of all of them, this is the gracilis. This is the gracilis, okay, that you saw in the cat. Again, very big. Remember that we had to clip through the sartorius and the gracilis to see a lot of things, okay? Underneath the gracilis, you're going to see the adductor muscles, just like you did in the cat. So this one right here is the adductor longus, sort of between the gracilis and the sartorius, adductor longus. And then there's sort of two muscles. It looks like you have two separate muscles here, but these are the same muscle. Okay, this is the adductor magnus. This is the human version of the adductor femoris. Okay, adductor magnus. Okay. Now, if we rotate to the back, these are the hamstrings. Remember I told you guys the hamstrings in the back of the leg? Okay, so we've got a hamstring set of muscles on the medial side and a set of hamstring muscles on the lateral side. Okay, so on the medial side you have the semitendinosus on top, semimembranosus on bottom, just like you did in the cat. Okay, the tendinosus is superficial to the membranosus. Okay, semitendinosus, semimembranosus underneath it. Okay, and then on the lateral side, just like you had in the cat, the lateral hamstring muscle is the biceps femoris. Okay, biceps femoris here. Okay. Again, just like in the cat, what is the calf muscle here called?
The gastrocnemius.
Gastrocnemius. The gastrocnemius is your cat's calf muscle. Okay, so there's the hamstrings there in that slide, and the gluteus maximus and medius.
The soleus is underneath it, right?
There, that's the view we're looking at right there. Okay, so the gastrocnemius here. The soleus is going to be this sort of broad muscle underneath it, so it might help for me just to pull this off, because you can see it from the side. So gastroc here, soleus here, gastrocnemius here, soleus here, gastrocnemius here, soleus here. Okay, see that it's deep to it? Okay, you can pull this one off and see the soleus underneath it. Okay. Now, with the rest of the muscles in the lower leg, we rotate laterally, okay? And then we see this muscle here on the lateral side of the leg. This is the fibularis. You don't have to worry about longus or brevis. Okay, just fibularis is fine. Here, lateral side. Next, extensor digitorum for the toes. And then finally, tibialis anterior. And then just like in the cat, when you go past the tibialis anterior, you see a bone. That's the tibia. Okay. And then that'll be it. That'll be it for the leg muscles. Okay. You guys have any questions?